One child has reportedly died from liver failure, and at least 4 children required a liver transplant as the result of a mysterious outbreak of hepatitis. The CDC has issued a nationwide health alert on cases, as cases are now identified in 6 U.S. states. News 19's Archie Snowden's been following the stories from the beginning and has an update.
Okay, Greg, and as you mentioned, the CDC announced that child has died in the state of Wisconsin, and health officials are now worried that this may be indeed part of an outbreak, but they have no idea where this outbreak is coming from. Earlier this month, researchers in the United States and Europe announced that they were investigating a small cluster of cases of acute hepatitis in children that has emerged across the globe. The Centers for Disease Control and Prevention immediately released an alert to doctors to be on the lookout for these unusual cases.
We followed these unusual cases along with the children's hospitals, and when the case count started to go up a little bit, we put out a health alert in early February to our providers across the state to be on the lookout for cases of liver inflammation associated with diarrhea and vomiting type symptoms.
Health officials have been on the lookout to find anything that these cases have in common. Health experts from around the globe agree that it's hard to explain. Acute hepatitis is often caused by food contamination, but that has not been connected to any of these cases. There have been 20 total cases identified in the United States in 6 states: Delaware, New York, Illinois, North Carolina, Wisconsin, and 9 reported cases here in Alabama. The CDC reported that 1 child has died in Wisconsin.
The other thing we've been doing is looking at any links between these patients or any other things that we can determine, but so far we haven't been able to find anything.
Globally, there have been 170 cases identified according to the World Health Organization, with many of the children under the age of 10. All of the children were otherwise previously healthy.
I think having awareness of signs of liver disease, again, yellowing of the eyes, yellowing of the skin, are things that pediatricians should really pick up on. And when they see these things, to let us know so we can evaluate them further.
The only link so far to all of these children is adenovirus 481, which is associated with the common cold, and there is no evidence so far that the COVID vaccinations or COVID-19 are associated with this outbreak. For Now We're Live, Archie Snowden, News 19.